Do you have back pain while sleeping? Let's talk about some of the potential causes and solutions to help reduce your pain. I'm Dr. Jordan Burns. I'm a chiropractor, a certified sleep science coach, and author of the book Supercharge Your Sleep. If you're experiencing low back pain, know that you are not alone. The American Chiropractic Association says that at any one time, 31 million Americans are experiencing low back pain. And 80% of people will experience low back pain at some point in their life. It's important to be reducing back pain while we sleep because sleep is one of the most important, if not the most important aspect of our health. Now let's talk about some of the things that cause back pain. One of the most common causes is a muscle strain. So you're going to get muscle strains from the habits that you do every day, and they compound over time. That's sitting at a desk all day, that's hunching over and lifting something at work. It's like I said, it's doing the things that you are doing just repetitively over time, and that's eventually going to wear on the muscles and cause a strain. So a second cause of back pain would be your structural issues, stuff that I deal with on a daily basis. That's your compressed nerve, your sciatica, your disc bulge, your disc herniation, any type of arthritic condition, any type of structural change that can definitely be causing your back pain. And lastly and least likely would be if you have some type of infection, a spinal infection, kidney, pelvic, bladder infection, something along those lines. It is least likely, but that could be a reason why you're experiencing pain. Now let's talk about the impact of back pain on sleep. A 2004 Korean study showed that 32% of their respondents that had low back pain experienced sleep disturbances because of their back pain. And a previous Australian study showed that patients that had acute and chronic low back pain, 58% of the patients experienced sleep disturbances because of their pain. And unfortunately, this just causes a vicious cycle. When you have pain, you don't sleep as well. When you don't sleep as well, you typically are going to have more pain because your body heals whenever you sleep. So this can cause a vicious cycle, and it's something that is extremely important to be addressed. Now let's talk about some optimal sleeping positions for alleviating back pain. So number one, we're going to talk about side sleeping. I want to make sure that your body is neutral and in alignment if somebody is looking at you from behind. So I want to make sure that you have a pillow that's supporting your neck so that you're not kinked to one side or going up to the other. I want to make sure that your pelvis and low back are neutral. So usually that's going to be putting a pillow in between your knees and so that someone looks from behind you and sees that your spine is straight. So then the back sleeping tip would be similar. I want to make sure that I have a pillow that's supporting my head and neck, and then I want to have a little pillow that's underneath my knees so that I'm taking and alleviating some of the pressure off of my low back, and that should help alleviate some of the pain. And then lastly, stomach sleeping is honestly just something that I wouldn't recommend. Usually when you're sleeping on your stomach, you're going to be having your head twisted one way or the other for an extended period of time, and it's typically going to cause a little bit more compression on your low back. Now let's go over the role of your mattress. We spend almost a third of our day on our mattress, so having a mattress that is good for comfort and support is extremely important in the overall health of our body. So the support comes from the core of the mattress, so typically you're going to have a foam layer or the inner springs that make up this layer of the mattress. And then the comfort layer just speaks to your bed's ability to alleviate pressure points and pain. I typically prefer a medium firm mattress because I feel like it's a good happy medium between comfort and support, and it's something that helps keep your spine in a neutral alignment whenever you're sleeping. If you're looking for a more natural product, then I would look for a mattress that's made of latex. So let's talk about some additional tips to minimize back pain during sleep. So typically if I'm talking about getting in and out of bed, if you're having pain on your right side, you want to make sure that you're rolling to your left side and pushing yourself up with the opposite hand so that you're always making sure you're keeping pressure off the side that has the pain on it. And then I want to emphasize again using pillows for support. So if you're laying on your back, you want to have a pillow underneath your knees so that you're alleviating pressure off your low back. And then if you're on your side, you have a pillow in between your knees so that you're keeping your low back and pelvis neutral. So lastly, let's talk about your mattress age. So it's typically suggested that you keep a mattress for 8 to 10 years. And a study from the NIH showed that 68% of people had a reduction in their back pain after only having a new mattress for 4 weeks. Now let's talk about some lifestyle factors that help prevent back pain. Number one is keeping a healthy body weight. Obviously, the more body weight that you have in your body, it's going to cause more compression on your spine. It's going to cause more compression on your discs, which is going to cause compression on your nerves and your nervous system. So anything we can do to help alleviate the pressure on the nervous system is going to help overall with pain, and maintaining a healthy body weight is definitely one of those things. And then next would be exercise and stretching. So in terms of exercise, a body in motion stays in motion. Movement is medicine. You want to make sure that you have an exercise routine that not only you enjoy, but that you can do long term for the rest of your life, because that is truly the key to moving into your later years, is finding an activity that you enjoy and can maintain consistently. And then mobility, you want to make sure that you have a mobility and stretching routine, again, that you can sustain and that you do regularly even when you're not in pain. And then in terms of ergonomics and posture, the biggest thing I can emphasize is if you're sitting at a desk all day, being able to get a standing desk. So that way you can stand for an hour, sit for an hour, because no matter what you're doing, if you're sitting for 8 hours, if you're standing for 8 hours, you're still doing the same compound movement over time that's going to cause pain. So the biggest thing is if you have the option of getting a standing desk, getting a standing desk. If you don't, if you have to stand for 8 hours or if you have to sit for 8 hours, then you need to ideally set a timer to where you're able to get up and take a small break every 30 minutes to 60 minutes. In conclusion, being able to reduce back pain while sleeping is one of the most important aspects of our health. Sleep is one of the most important pillars of health, if not the most important pillar of our health. And the better we sleep, the healthier we are. So I encourage you to implement the tips that I talked about in this video, whether that's the sleep positions, whether that's the lifestyle factors, or anything else that can overall just improve the quality of your sleep. These are things that are so important for living a healthier and happier life. So sleep well.